Hovertech International's positioning wedges offer turning and support to achieve optimal offloading for pressure injury prevention. The wedges are available in disposable and reusable forms to support your facility's Q2 compliance. The recommended 30-degree turning angle is provided for patients at risk for developing pressure injuries. The non-slip covers reduce sliding and secure the wedges in the proper placement under the patient and on the bed surface. The wedges provide the optimal solution for pressure injury prevention, offloading, and maintaining the proper patient positioning. The wedges effectively offload the sacrum, while the HoverMatt single patient use link or HoverSling repositioning sheet can be used to safely position the patient, eliminating skin shear and reducing the force required to transfer and position patients for a comprehensive solution. This technique will demonstrate repositioning a patient using the HoverMatt Pros wedge with a single caregiver and the HoverMatt SPU link. This same technique applies if using the HoverSling repositioning sheet. Raise the side rails on the opposite side of the bed that the patient will be turned toward. Inflate the HoverMatt SPU link using a Hovertech air supply. Slide the patient toward the edge of the bed on the wedge placement side. Locate the patient's sacrum and place the wedges between the bed surface and the HoverMatt SPU link. The HoverMatt Pros wedge has a non-slip foam material on the bottom back edge to keep the wedge from sliding. To place the wedges, slide the wedge on a forward angle to the desired location, then set down to lock in place. To adjust, pick up back edge and slide further or pull back. If using the HoverMatt Pros wedge with the tail, insert the tail under the patient's thighs as far as possible. Place the other HoverMatt Pros wedge without the tail about a hand width above the lower wedge to support the patient's upper body. Raise the side rails. On the opposite side of the bed, pull the tail through to the other side of the patient to secure the wedge. Deflate the HoverMatt SPU link. Check wedge placement by placing your hand between the wedges, confirming the sacrum is not touching the bed. Raise the head of the bed as desired and recheck the sacrum. The HoverMatt Pros wedge, while for single patient use, can safely be wiped down to clean and disinfect, then stored for later use. This technique will demonstrate how to place wedges using the air-assisted push-down method to turn a patient with the HoverMatt SPU link. This same technique applies if using the HoverSling repositioning sheet. Begin by placing the bed in supine position and ensure the patient is centered on the HoverMatt SPU link. Insert the air supply hose into the foot end of the HoverMatt SPU link and initiate airflow by pressing the appropriate button corresponding to the HoverMatt size. With the HoverMatt fully inflated, slide the patient in the opposite direction of the turn and as close to the edge of the bed as possible to ensure the patient is centered on the bed following the turn. Bend the patient's knee to assist with the turn and for comfort. To turn the patient on their side, simultaneously the caregiver on the side the patient is turning toward will gently push down on the HoverMatt at the patient's shoulder and hip. As the patient is turning, the same caregiver will stabilize the patient while the second caregiver gently pulls up on the HoverMatt handles, palms up. The second caregiver hands the first caregiver the handles of the HoverMatt SPU link and turns off the airflow. Locate the patient's sacrum and place the first wedge below the sacrum. Place the other wedge about a hand's width above the lower wedge to support the patient's upper body. Lower the patient onto the wedges, ensure the patient's straps are not underneath the patient. Check wedge placement by placing your hand between the wedges, confirming the sacrum is not touching the bed. Raise the head of the bed and recheck wedge placement. This technique will demonstrate how to utilize a mobile or ceiling lift to turn a patient for wedge placement with a HoverSling repositioning sheet. To begin, detach the link straps and raise the side rails. Slide the patient to the side of the bed by either using the Air Assist feature of the HoverMatt SPU link or the HoverSling repositioning sheet, or by utilizing the lift and sling straps for the HoverSling repositioning sheet. Attach the shoulder and hip handles of the HoverMatt SPU link or the shoulder and hip straps of the HoverSling repositioning sheet to the hanger bar, which should be parallel to the bed. Raise the lift to initiate the turn. Locate the sacrum and place the wedges. Position the reusable bariatric size wedge directly above the sacrum. If using standard wedges, place the lower wedge first under the sacrum, then position the other wedge a hand's width above the lower wedge to support the upper body. Lower the patient onto the bed, ensuring the wedges stay in place as the patient is lowered onto them. Reconfirm placement after the head of the bed is raised. Hovertech offers a variety of wedge solutions for ease of use and supporting Q2 protocols.